Scabies is a parasitic skin infection which is caused by a small mite that lives in the skin. Scabies is important because it spreads fast, especially in schools and any overcrowded environments. Scabies usually doesn't cause death, but it causes important discomfort for daily life, social stigma, and psychological distress. In low-income communities, almost 24% of children will be affected by scabies. It is a very common disease. The hallmark of the disease is intense and relentless itching that is significantly worse at night. Itching medically is called pruritus. Beside itching, the second most common sign is a red rash on the skin, usually as papules. Sac and linear burrows, small tunnels which are made by the mite into the skin. These tunnels are usually seen between the fingers on the wrist, around the waist, and genital areas. If a person itches intensively, the tunnels can be difficult to see.
And when scabies occurs, it occurs between family members also, due to its high transmissibility in case of close contacts. In some cases, especially in children, they may have nodules on the skin which are brown-red and 1-2 centimeters in size, especially in the groin, genitals, and buttocks. And they may persist for months even after successful treatment. These nodules are a hypersensitivity reaction. Besides this discomfort brought by scabies, another problem is secondary bacterial infection due to intense itching of the skin, which occurs in 30% of scabies cases. At this case, we look for signs of impetigo, honey-colored crust or redness, swelling, warmth, and pain, which means cellulitis. They indicate secondary bacterial infections. Any patient with persistent, unexplained itching, especially if it's worse at night, should be evaluated for scabies.
The cause of the disease is an 8-leg mite, which is called Sarcoptes scabiei. Hominis. The mites are transmitted through direct, prolonged skin-to-skin contact. With an infested person, less commonly, transmission can occur through sharing infested clothing, bedding, or towels. The female mite burrows into the skin, the outermost layer, not deep, and creates a tunnel and lays 2-3 eggs per day within the burrow. The eggs hatch in 3-4 days, releasing larvae. The larvae molt into nymphs and then into adult mites. The human immune system starts to react against the mighty eggs and mighty faces. That's why a person has such intense itching. Generally, scabies is highly contagious, especially with close skin-to-skin contact. Also important if there is crusted scabies or not. In case of crusted scabies, mites can be millions and highly contagious. Brief, casual contact like shaking hands and a quick hug with someone who has classical scabies is generally considered low risk, but not zero risk. The incubation period of the disease can be up to 6 weeks. From infection to symptoms, the time until the immune system becomes sensitized.
It's important to say that in immunocompromised persons, scabies can be crusted. So on the skin, crusts are created and look like proteases, and in such cases, a person is infested by millions of mites, and transmission from such a person is very easy. For comparison, an average infected person has only 10 to 15 mites. The disease spreads among children due to close contact, and in adults, it commonly spreads via sexual contact or between family members. Diagnosis is confirmed with direct visualization of mites' eggs or fecal pellets, scabiei from skin scrapings, dermoscopy, or an adhesive tape test. Scabies can look like other dermatological diseases like atopic dermatitis and contact dermatitis or other insect bites. They can be very itchy, but typically lack the characteristic burrows and nocturnal exacerbation of scabies. In case of eczema, there is the history of asthma, eczema, or hay fever in the family commonly.
This treatment, the prognosis of scabies is excellent. Symptoms will completely resolve within 4 weeks. Itching may persist for several weeks after the mites have been eradicated. Reinfestation is possible if close contacts are not treated simultaneously or if the treatment is not used correctly. The treatment is with permethrin 5% cream. This is the most commonly used and most effective topical treatment. It's applied to the entire body from the neck down, including under fingernails and between the toes, and left on for 8-14 hours, usually overnight, before being washed off. A second application 1-2 weeks later is often recommended. In severe cases, or if topical treatment fails, oral ivermectin is an alternative. It's typically given as a single dose based on body weight, and a second dose is often given 1-2 weeks later. Ivermectin is not Food and Drug Administration approved for scabies in all countries, but it is widely used off-label. All household members and close physical contacts should be treated simultaneously, even if they don't have symptoms, to prevent reinfestation.
Wash all bedding, clothing, and towels used in the past week in hot water, at least 50 degrees Celsius or 122 degrees Fahrenheit, and dry on a hot cycle. Items that can't be washed can be sealed in a plastic bag for at least 72 hours. Other natural remedies, example given, neem oil, clove oil, are sometimes promoted, but there's no reliable evidence to support their use, and they could potentially cause skin irritation or allergic reactions. Now let's say how to protect ourselves from scabies. Don't share bedding, clothing, towels, or other personal items with someone who has scabies or is suspected of having scabies. If someone you live, eat, or have close contact with is diagnosed with scabies, get treated prophylactically, even if you don't have symptoms. If you care for someone with scabies, wear gloves. Wash your hands thoroughly after any contact.
If someone in your household has scabies, limit close physical contact until they have completed treatment. This doesn't mean complete isolation, but avoid prolonged cuddling, sleeping in the same bed, etc. If someone has crusted scabies, isolation in a single room until the treatment is completed. Always wear gloves, gowns, and potentially shoe covers when entering the room. Thoroughly clean and disinfect the room and any items the person has come into contact with. Repeat treatment is not required. The risk of transmission from surfaces in cases of classical scabies is relatively low, provided there's been no recent direct contact with an infested person's skin. Mites don't survive long off a human host, typically 24-36 hours, but up to a week in ideal conditions.